If you worry about your health a lot, even though you're not seriously ill, then this video is for you. I'm Dr. Liz White. I'm a consultant clinical psychologist and OCD and anxiety expert. And in this video, I am going to take you through the basics of health anxiety so that you will be able to recognize the signs and the symptoms, as well as learning about the vicious cycle of health anxiety. And as a bonus, I'm going to talk through how health anxiety and OCD can overlap. Now, I will be doing a follow-up video on how to cope with health anxiety, so be sure to hit the subscribe and bell button so that you are notified when I release that video. So what are the signs of health anxiety? Number one is excessive worry about your health, alongside lots and lots of anxiety. You may have worries like, is this headache a brain tumour? What's that lump? Is it cancer? What if I get cancer? What if I get some horrible neurological disease? Could this mark on my leg be something serious? Number two is excessive reassurance seeking. So you may make repeated visits to your doctor or your local hospital to try and get tests or to get the reassurance that you're okay. You may also seek reassurance from your family or your friends. So does this lump look suspicious to you? Or is there a history of brain tumours in our family? Now, this reassurance seeking temporarily provides relief because the doctor might say, no, you're fine, you're okay. But it doesn't last. But more on that later. The next sign that you might be experiencing health anxiety is that you check your body. So you repeatedly check your body excessively for lumps and bumps and pains and different physical sensations. Your attention narrows to your body and what's happening with it. And when health anxiety is severe, you may be doing this multiple times a day. The next sign is that you might be using the internet to check for symptoms or perceived ailments. And there is a term for this called cyberchondria, which is where you use the internet excessively to try and gain medical information about perceived ailments, but that only exacerbates the anxiety about your health. And lastly, health anxiety can have a massive impact on your life, and it can really make it difficult to do daily tasks because your mind is taken up with worries about your health. Now, the other impact that health anxiety can have is on your mood. So not only are you feeling exhausted from that mental load of all that worry, it can also pull your mood down. And as you start to feel low, you lose motivation to do your usual activities. Perhaps you isolate yourself or you withdraw from your social group. You stop doing the things that you love to do. And then you're in a whole other vicious cycle because the less you do, the less you want to do, further pulling your mood down and further making the anxiety worse. So now on to the vicious cycle of health anxiety. Now, there are various different components to what make up the process of health anxiety, but what generally tends to happen is that something triggers a sense of threat. And this can be an internal thought or a physical sensation or a pain that you feel somewhere in your body. And obviously this leads to feelings of anxiety, fear, nervousness, as well as anxious thoughts. Now, the important thing to say here is that in health anxiety, what very quickly happens is a catastrophic misinterpretation of physical sensations and symptoms, i.e., the headache is interpreted as a brain tumour, as something that's wrong, as an illness, as a condition, as a disease, rather than it's just a headache. And that leads to a cascade of anxious thoughts. Oh my God, this is really serious. This is really bad. I'm going to die. And when we feel anxious, when we feel under threat like this, we are hardwired to ensure our own survival. So we go into coping strategy mode. And this is where the reassurance seeking and the checking all come into play. Let's say that you've got a really bad headache and you are anxious about your health. What you might do is have the catastrophic misinterpretation that this headache is something really serious, but you don't know if it's serious or not. You're experiencing uncertainty alongside the anxiety. So what do? You go and gain certainty somehow. So you get on to the internet, you search up, are bad headaches serious? What are the symptoms of brain tumours or brain aneurysms? Or you may check your body, so you may check your head or your neck for lumps and bumps to sort of see whether is there anything else that indicates that there's something wrong. You may go and get reassurance. You may think, well, look, I've got this really bad headache, I need to get checked out. You book in with the doctor. You may ask your partner, look, I've got this really bad headache. Do you think it's something serious? And all the while trying to get an answer, trying to get certainty because you feel so anxious. But all this does is it narrows your attention to your body, to that headache, which then fuels further preoccupation with your body, with your physical sensations that you're experiencing. Now, the checking and the reassurance seeking may provide temporary relief, but it doesn't last because your mind has a great ability to produce more anxious thoughts, more worries. That puts you right back in that cycle once more. So let's move on to how health anxiety and OCD can overlap. In both OCD and health anxiety, you will experience doubt, intrusive thoughts, a sense of urgency to do something, like the repetitive checking or the reassurance seeking. Another similarity is the overestimation of threat to yourself. In both, there are difficulties with ambiguity and uncertainty, like it's really difficult to experience uncertainty. And also, research shows that exposure and response prevention, which is one of the main treatments for OCD, is also really effective in treating health anxiety. But there is one important difference between OCD and health anxiety. Now, research shows that people who have severe health anxiety tend to believe that their fears about their health are realistic, that they really are sick or they really do have a particular ailment. But with OCD, there is more awareness that the intrusive thoughts and worries are unrealistic. If you are experiencing intrusive thoughts about your health, then that's more likely to be health anxiety than it is OCD. But there are situations where someone can experience OCD and health anxiety. Now, at the end of the day, whether you label it as OCD or health anxiety, it is all distressing. But there are things that you can do to help health anxiety. And as I mentioned, I will be doing a whole separate video on some really good strategies to help you manage the symptoms. So don't forget to subscribe, like, and hit the bell, and I'll see you next time.